how this goes. Which brings me to another question, which is, we discuss very much, for example, the turning pattern, the homologous pattern, the crawling pattern. But the very basic pattern of lying on your back and moving your legs and arms has no name. It is neither a crawling necessarily, or it may not lead to turning, it may not lead to crawling, and you're on your back.
Just an undifferentiated homologous pattern?
Well,
supine?
that's yeah, but it might be homologous. It may not be a homologous pattern. It may be a crawling pattern. You're on your back with contralateral movements of the limbs or homologous movements of limbs, but you are not going anywhere. You are staying on your spine and you are just moving, just like the baby does in the beginning, although we call it something else. But when it comes to definition, it is interesting to think of getting a consensus around how we term these movement patterns, because it really opens up a whole new thought process of, well, do we call a movement pattern do we define it by the fixed points or the stabilizing points, or we define it by its intent, what it ends up doing?
And this is, no, you're bringing up something that is touchy and confusing.
It is.
Yeah, because, well, you said it. It's when we use terms like ipsilateral, contralateral, differentiated, undifferentiated, homologous, I think that we kind of say, well, you can define it in terms of the fixed points, or you could define it in terms of the mobile points.
Mm-hmm.
We don't necessarily, at least I never thought of it. I think of like, the differentiated patterns can lead to some kind of movement, whether it's ipsilateral movement in the form of rolling or contralateral movement in the form of crawling, walking. But I never, in my brain, I never immediately make the jump to differentiated is walking and locomotion, and undifferentiated is not locomotion. I just think of it as, okay, undifferentiated means the limbs are doing the same function, and differentiated means the limbs are doing opposite functions, and depending on what side of the bodies the fixed points are on, it's either ipsilateral or contralateral. Now you're throwing a wrench into my whole hierarchy of movement patterns. I'll take a DNSA course in 6 months. We'll figure it out. I'll figure it out.
Okay, yeah, because we really, for analysis and discussion, not that it has to be solved anytime soon, but really when you are thinking of describing, what happens if you're swimming, that's a locomotory pattern with central.
Oh, God.
Yeah, it's a locomotory pattern, but a central fixation. So again, now you have
central fixation in the terms of
the spine. The fixed point is proximal, and So we then start getting into the question of what is a movement and what is a movement pattern, because those are two different things. Movements are infinite. Movement patterns are limited, and therefore have to be defined not by their phasic. Because if you define,
I was going to say, let's talk about it a little bit. I think we have behind the scenes talked about the idea of patterns before and how to kind of describe them, and where the fixed points are on some of the developmental positions that kind of make it's tricky. It's tricky to describe things. But I think what you have said and what we've talked about is that there are there are muscle chains that function within these patterns. And I used to even get patterns and chains mixed up. I have oblique chains that are contralateral patterns. It's like, no. The oblique chains can function within the ipsilateral
they're
pattern,
fixed.
within the contralateral pattern,
Right.
within they can function within any of this. So I think the patterns are dependent on the fixed points, and that means that they are ultimately defined by ipsilateral patterns, contralateral patterns, and homologous patterns. Now, homologous to my ear and brain is totally synonymous with undifferentiated.
That's true. But you can have, yes, if I'm standing on my feet, if I'm lying on my back, that's quite a different thing. So,
that's the problem.
There's
that's
a central pattern where the spine is the fixed point, and the arms and legs are free to do quite a varied degree of things, whether the legs go side to side, or they go in the sagittal plane, or we rotate half the body one way or the other using the arms. So there are some things that are really, you're going, this is not going anywhere. The person is not turning anywhere. They're not walking anywhere. And that comes again to the fact that you can have ipsilateral fixed points, but they're not turning patterns. They are not going to turn. They are just fixated on one side, whilst the person uses two limbs on the same side to perform basic activity, which may be quite different. The upper limb and the lower limb may do quite different things, but they're fixated on one side. For instance, in ballet, I hold on to the bar. My arm on the one side is fixed. My foot is on the floor. But the arm and the leg that is free are doing two totally different things. They're neither turning in nor turning out. They're doing two different movements. So you have an ipsilateral pattern. You have ipsilateral fixed points that aren't turning. They're not a turning pattern. So you can almost say that all turning patterns have ipsilateral fixed points, but not all ipsilateral fixed points are turning patterns. Yes. And the same goes for contralaterality.
Right.
Yeah. So
that's the contralateral is the standard bird dog.
That's right.
Bird dog is not going anywhere.
It's not going anywhere.
Versus crawling is obviously locomotion.
That's right.
Maybe that is the final qualifier. Is this a static use of a pattern or a dynamic use of a pattern?
Right. And I mean, if you're lying on your back, you're definitely not going anywhere unless you you decide to turn. That is your option. If you're on all fours and you perform a homologous pattern, you can just rock backwards and forwards. You can't even rock side to side.
Not really. Yeah, not really.
Not really. But what you call rocking side to side, that is a quadrupedal pattern, non-locomotory, which is differentiated. Yes.
Yeah.
So there are, it's interesting, but again, if we hadn't had this DNS background, we wouldn't even be having this discussion.
Right. There would be no foundation for it. We wouldn't even know that we didn't know what the hell we were talking about.
Yes, we wouldn't know we didn't know anything about this.
Matter of fact, I wish I could just forget it all at this point. Make my life a lot easier. Just do some bicep curls.
Just curl away and leave us in for peace.
Start with 10 pounds after 4 weeks.
I know, and let's not call it anything at all.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook @IMTR Seminars.